Phlebotomy Certification Practice Exam. Question 1. What is the primary reason for using gloves during venipuncture? Improve grip. Protect the patient. Protect both patient and phlebotomist. Prevent hemolysis. Gloves act as a barrier against blood-borne pathogens, protecting both the healthcare worker and the patient from cross-contamination. They are not optional and are required under standard precautions regardless of perceived risk. Gloves should be changed between patients and hand hygiene performed immediately after removal. Never wash or reuse disposable gloves, as this compromises their barrier function and may spread infection. Question 2. A patient faints immediately after needle removal. What is the most appropriate initial action? Assist patient into supine position. Apply pressure to site. Offer water. Call emergency services. Syncope is typically vasovagal and resolves when cerebral blood flow is restored. Positioning the patient supine with legs elevated prevents injury and promotes recovery. Emergency services are only needed if the patient does not regain consciousness promptly. After positioning, check vital signs, apply a cold compress to the forehead, and monitor the patient until fully recovered. Document the episode in the medical record. Question 3. Why is recapping needles strictly prohibited? It increases needle stick injuries. It damages the needle. It wastes time. It contaminates specimens. Most occupational needle stick injuries occur during recapping. Modern safety devices eliminate the need for recapping, and OSHA regulations strictly prohibit this practice to protect healthcare workers. If a needle must be recapped, e.g., for certain procedures, a mechanical device or one-handed scoop technique must be used. Never use two hands to recap a needle, as this significantly increases the risk of accidental puncture and exposure to blood-borne pathogens. Question 4. What does a lavender top tube primarily test? Coagulation factors. Blood chemistry. Hematology parameters. Glucose levels. Lavender top tubes contain EDTA and are used for hematology testing such as CBCs, where cellular integrity and accurate cell counts are essential. EDTA preserves cell morphology by binding calcium, preventing clotting without damaging red or white blood cells. Common tests include complete blood count, CBC, erythrocyte sedimentation rate, ESR, and blood smears for differential analysis. Lavender tubes should be filled completely and inverted 8 to 10 times immediately after collection. Question 5. Which factor most contributes to patient discomfort during venipuncture? Needle gauge. Poor anchoring technique. Tourniquet placement. Tube inversion. Poor anchoring allows the vein to roll, increasing tissue trauma and pain. Proper anchoring stabilizes the vein, improving accuracy and patient comfort. The phlebotomist should use the thumb of the non-dominant hand to pull the skin taut about 1 to 2 inches below the puncture site. Anchoring also prevents the vein from moving away during needle insertion, reducing the need for probing or multiple insertion attempts, which cause additional discomfort. Question 6. What is the most important step in patient identification? Checking the requisition. Asking the patient to state their name and DOB. Confirming room number. Matching tube color. Active patient identification using two identifiers is the gold standard. Never rely solely on charts, room numbers, or labels prepared in advance. Ask the patient to state their full name and date of birth, open-ended questions, then compare this information to the requisition and wristband. Avoid yes/no questions such as "Are you Mr. Smith?" as they can be answered incorrectly. If the patient is unable to respond, use the wristband and verify with nursing staff. Question 7. A phlebotomist draws blood too quickly from a small vein. What complication is most likely? Clotting, syncope, infection, hemolysis. Rapid flow through a small vein increases shear stress on red blood cells, causing hemolysis. Controlled collection is essential for fragile veins. Using a butterfly needle with a syringe allows the phlebotomist to control draw speed and reduce pressure on delicate veins. If a vacuum tube must be used, select the smallest pediatric tube available and partially fill if appropriate, with caution, as underfilling can affect the blood-to-additive ratio in anticoagulant tubes. Question 8. Why is the gray top tube drawn last in the order of draw? It clots quickly. It contains strong additives. It requires full volume. It is temperature sensitive. Gray top tubes contain powerful additives, sodium fluoride and potassium oxalate, that can interfere with other tests if carried over. Drawing them last minimizes contamination risk. The fluoride inhibits glycolysis for glucose testing, while oxalate acts as an anticoagulant. These additives can falsely lower calcium and affect other enzyme assays if they contaminate tubes drawn later. Gray tubes should always be the last tubes drawn in a multi-tube collection. Question 9. What is the primary purpose of applying pressure after needle removal? Stop blood flow immediately. Reduce pain. Allow vein to seal. Prevent infection. Pressure allows the puncture site to close and the vein wall to reseal, preventing hematoma formation. Infection prevention is addressed through skin antisepsis, not pressure. Apply firm pressure with gauze for 3 to 5 minutes, longer for patients on anticoagulants or with bleeding disorders. Instruct the patient to keep the arm straight and avoid bending the elbow, as this can dislodge the clot and cause bleeding or hematoma formation. Question 10. Which patient is at highest risk for post-venipuncture complications? Patient on anticoagulants. Athlete. Young adult. Dehydrated patient. Anticoagulants impair clotting, increasing bleeding risk and hematoma formation. These patients require special monitoring and extended pressure, 5 to 10 minutes or longer. The phlebotomist should use smaller gauge needles, apply gentle tourniquet pressure, and observe the site for continued bleeding before bandaging. If bleeding persists despite extended pressure, notify the provider and consider applying a pressure bandage. Document the prolonged bleeding time in the medical record. Question 11. Why is immediate tube labeling at the bedside critical? Prevents misidentification. Improves workflow. Saves time. Meets storage requirements. Labeling away from the patient increases the risk of specimen mix-ups, which can lead to catastrophic diagnostic errors and patient harm. Labels should be applied immediately after collection while still in the patient's presence. The patient should be asked to verify the information on the label, name, date of birth, before the phlebotomist leaves the room. Never pre-label tubes or label specimens after leaving the patient's bedside, as this increases the risk of misidentification. Question 12. Which complication results from blood leaking into surrounding tissue during collection? Hemolysis. Petechiae. Hematoma. Thrombosis. A hematoma occurs when blood escapes the vein and pools under the skin, causing swelling and bruising. Hematomas are often caused by the needle being only partially inserted into the vein, allowing blood to leak into tissue. If a hematoma forms during collection, immediately withdraw the needle, apply firm pressure, and select an alternative site if additional tubes are needed. Document the incident and monitor the site for complications such as increased swelling or pain. Question 13. Why should a tourniquet be released once blood flow is established? Improve comfort. Prevent hemoconcentration. Increase blood speed. Reduce pain only. Prolonged stasis alters analyte concentrations. Releasing the tourniquet restores normal circulation and improves specimen accuracy. The tourniquet should be released as soon as blood flow is established or within 60 seconds, whichever comes first. If multiple tubes are needed, the tourniquet can be reapplied briefly between tubes, but each application should not exceed 60 seconds. Hemoconcentration can falsely elevate hemoglobin, hematocrit, potassium, and protein levels, affecting diagnostic accuracy. Question 14. Which action best demonstrates professional phlebotomy practice? Speed. Minimal conversation. Clear patient communication. Drawing without hesitation. Clear communication reduces anxiety, improves cooperation, and enhances patient safety, which is more important than speed alone. Professional phlebotomists explain procedures, verify patient identity, obtain consent, and provide post-procedure instructions. Effective communication also includes active listening, addressing patient concerns, and using open-ended questions to assess understanding. Patients who feel informed and respected are more cooperative and experience less anxiety during venipuncture procedures. Question 15. What does excessive bruising after venipuncture usually indicate? Infection. Poor pressure application. Hemolysis. Vein collapse. Inadequate pressure allows blood to leak into tissue, causing bruising. Proper pressure duration, 3 to 5 minutes, is essential. Patients on anticoagulants or with bleeding disorders require extended pressure, 5 to 10 minutes. The patient should be instructed to keep the arm straight and avoid heavy lifting for several hours after the draw. If a large hematoma forms, apply ice to the area and notify the provider if swelling or pain persists. Question 16. Which test is most sensitive to improper mixing? Chemistry panel. CBC. Blood gases. Serology. CBC testing requires uniform anticoagulant distribution. Poor mixing leads to clotting and inaccurate cell counts. EDTA tubes must be inverted 8 to 10 times immediately after collection. Insufficient inversion can cause microclots that clog analyzers and produce falsely low platelet and white blood cell counts. If a CBC specimen is clotted upon arrival at the lab, it must be rejected and recollected, which delays diagnosis and treatment. Question 17. Why must safety devices be activated immediately after needle removal? Reduce pain. Improve efficiency. Prevent accidental exposure. Protect specimens. Immediate activation prevents accidental needle stick injuries, protecting healthcare workers from bloodborne pathogens. Safety devices should be activated using one-handed technique according to manufacturer instructions. Never delay activation until after disposing of other supplies, as this increases the risk of injury. After activation, discard the entire needle assembly into an approved sharps container without recapping. OSHA regulations require safety-engineered sharps devices and immediate activation after use. Question 18. Which factor most increases the risk of syncope during venipuncture? Cold room. Anxiety. Large needle. Long draw time. Anxiety triggers a vasovagal response, causing sudden drops in blood pressure and fainting. Proper reassurance reduces this risk. Patients with a history of syncope should be drawn in a supine position. Distraction techniques, such as engaging the patient in conversation or asking them to focus on breathing, can help reduce anxiety. Avoid showing the needle to anxious patients, and consider using a smaller gauge needle or butterfly set if appropriate. Monitor patients closely during and after the draw. Question 19. What is the most important goal of proper phlebotomy technique? Speed. Patient comfort. Accurate laboratory results. Minimal supplies. While comfort and efficiency matter, the ultimate purpose of phlebotomy is to obtain accurate, reliable specimens that lead to correct diagnosis and safe patient care. Proper technique includes correct patient identification, appropriate site selection, proper needle insertion and withdrawal, correct order of draw, adequate tube filling and mixing, and appropriate specimen handling and transport. Inaccurate results due to poor technique can lead to misdiagnosis, inappropriate treatment, and patient harm, outweighing any benefits of speed or patient convenience. Question 20. Which situation presents the highest risk for specimen hemolysis even when needle size is correct? Shaking additive tubes vigorously. Transferring blood too slowly into tubes. Drawing from a hand vein using a syringe. Releasing the tourniquet after tube removal. Vigorous shaking causes mechanical rupture of red blood cells leading to hemolysis. Even correct needle gauge and gentle draws cannot prevent damage caused by improper tube mixing. Tubes should always be inverted gently, not shaken. Hemolyzed specimens are rejected by the laboratory, requiring recollection. This delays diagnosis and treatment and causes additional discomfort for the patient. Always mix additive tubes by gentle inversion 5 to 10 times, depending on the tube type, never by vigorous shaking.